the Pseudomonas, Staph aureus, Neisseria, Anthrax and Rickettsia. These are repeated more than 3 times, okay, for anesthesia. So, if you ask me everything, what is the most important topic? Most important topic is CPR. Then comes anesthetic agents and then muscle relaxants. Capnography has also been asked, so go through that pearl on capnography. See, in embryology, when I was going to the NEET PG previous year questions, I was very much shocked to find that only 3 topics carry the highest weightage. That is one pharyngeal arch, where every year one question is asked, and in CVS, fetal circulation and cardiovascular development, where every year one question is asked. Ear and nose was very important topic. Throat was not asked at all. But see the change in NEET PG pattern. In NEET PG, throat is asked the most. Throat and oral cavity. That to one topic, tonsillitis. Tonsillitis has been asked many times along with larynx. Okay. So you can see that in anatomy against INICT. Okay, because in INICT, CNS was the most important part. I already said it many times that if you don't study CNS in anatomy, you are going to fail for INICT. Okay, but in NEET the story is entirely different, because in NEET highest number of questions are asked from general part of anatomy, histology and embryology. So the next question is how to finish medicine within 4 or 5 days. So instead of the question how to study medicine, the best question is what to study in medicine, because not everything is important from NEET PG point of view. So if you see old NEET and new NEET, one important thing that can be noted is in new NEET, which is represented by red, questions from immunology, 1 or 2 questions only have been asked. So don't give much importance, because that will also be covered in pathology. So don't give much. Hello everyone, I am Dr. RMD, Pediatric Resident at PGIMER Dr. RML Hospital, New Delhi. So this is the part 2 video of revision strategy NEET PG 2024. Part 1 was discussed 2 weeks ago in this video, which was viewed by 58,000 of the audience. And in this part 1 of the video, we had discussed these 10 game-changing subjects. So we had a strategy for 2 months. So we had almost for 50 days, since we had kept 10 days for the last final revision. So in this 50 days, for the first 30 days, we had these top 10 very important subjects. So we had 5 combinations, so 6 into 5 was 30 days. So now you have rest 20 days left for the part 2. Okay, so we also saw that how we use this P4 S4 BF formula, and in this video, which was viewed by 88,000 audience, so this video actually discussed how we arrived at this conclusion, which are the most high yielding topics and which subjects were less important. So in this video, we will be discussing the less important 9 subjects, which was less important by terms of weightage. When we divided marks with relation to time, we got this 9 subjects and the other 10 important subjects. So this 3:1 ratio is what we follow. So according to that, we have still 20 days left for the other 9 less important subjects. So the most important query that I get nowadays is some of them tell that they can't finish all the subjects, so which subjects they can leave. So we will be discussing that also, which are the 2 subjects which are safest to be left, and so that you don't suffer much losses, you don't suffer much negative marks during your NEET PG. So first we'll be going to microbiology. So the 11th important subject is microbiology. So microbiology I have divided according to general microbiology, bacteria, mycology, virology, parasite and immunology. So out of this, the most important is of course bacteriology, but according to the time allotted, according to the syllabus that is present, parasitology seems to be the most important, because 22 questions were asked and only 27 from bacteriology. That to parasite only some important questions are being asked. Okay, then virology is also equally important, and as you can see, mycology is most consistently performing. So every year one or the other question is being asked from mycology. So mycology, that means you have to study everything from mycology. Okay, and as against INICT, where we saw the general microbiology also carries more significance, but here general microbiology, only one of the question carries very much most significance, and that we'll be discussing in the upcoming part of the video. We'll also see how old NEET and new NEET pattern have changed for microbiology. As a dictum, we saw in our first video, in the crack NEET PG 2024 video, where we saw that in new NEET PG question papers from the last 3 years, the number of questions in microbiology have come down. So when we divide this and represent it in the form of a pie chart, so we'll see that the important topics are mycology, which you are never going to ignore it. That will be the first topic that we'll be studying. Second, you'll be going to parasitology, and third, you will be going to bacteriology. So these will almost form out to 75% of the total topic. Okay, why I'm going to bacteriology and not virology also, I'll tell you in the upcoming in the next few minutes. Okay. So if you see old NEET and new NEET, one important thing that can be noted is in new NEET, which is represented by red, questions from immunology, 1 or 2 questions only have been asked. So don't give much importance, because that will also be covered in pathology. So don't give much importance to immunology of microbiology. I also say you what to read from immunology and microbiology. Okay, as you can see, parasitology more number of questions are asked, and mycology also equal number of questions are asked in the new NEET pattern. So my friend Viraj asked me what should I study, and I gave him a plan what to study for microbiology. So I gave him the list of top bacteria, top viruses and top parasites to study. So which are the important ones? The Pseudomonas, Staph aureus, Neisseria, Anthrax and Rickettsia. These are repeated more than 3 times. Okay, so it is a dictum, you must know this at the tip of your tongue. Syphilis also asked many times in sexually transmitted infections, and these 3 are asked once only, I think. So there not much importance is needed for this, but if you are giving all bacteria to be studied, you have to finish all these bacteria. I think there are around 9 bacteria, so all these 9 should be at the tip of your tongue. Top viruses, CMV has been asked many times. I think some 4 times CMV question has been repeated. Again, it has been also repeated in pediatrics also. So CMV is very important question. Rest of the things have been asked once or twice, but again inclusion bodies has been asked many times. Next, top parasites, malaria has been asked many times. Rest of them are asked once or twice. Again, parasite vectors have been asked many times. Mycology, there is no definite question from mycology, but every time one or the other question is asked from mycology, so that means that you have to study everything from mycology. And rest, very important is, for example, see this culture media. If you can see this previous year question papers from 2019, 2021, 2019, 2019, 21, 23, 22, one very consistent question in microbiology has been based on culture media and culture methods. So don't forget to read this topic from general microbiology. Also, when you are reading this topic from bacteriology, keep in mind that this question on culture methods and culture media has been asked many times, and these are to be seen and to be learned from image bank also, because these are image bank based questions also. One more such important question is antigen antibody reaction, which has been asked many times. I think some 4 or 5 times this question has been asked. There are many tests also based on antigen reaction, so you have to go through that also. And in immunology, if you want to go only through this graft, because graft versus host disease, renal transplant, HL antigen, these questions have been asked. So with respect to ionicity, one important difference that you can notice, E. coli has never been asked in NEET PG so far. So E. coli is only asked in ionicity, that too multiple times, but in NEET PG, E. coli has not been asked so far. So what should be a strategy for microbiology? First is go through these important topics. You are not supposed to leave this bacteria and viruses and top parasites which I mentioned along with some parts of general microbiology. Go in this order. First go through full mycology, then go through parasitology, bacteriology, virology, and then if you get time, go through the rest. So what are your sources? First main source is revision videos, because revision videos can be covered in 1 or 2 days. Then main videos you shouldn't watch because it will consume so much time, and now you don't have time. PYQs will be solved, pearls should be marked, and QBank only if you feel that suppose for example Pseudomonas is such an important topic, malaria is such an important topic. If you're not thorough with that, then you can go to the QBank so that you don't miss out any questions on that. MCQ discussion videos also you can watch. Rest YouTube and recent updates you don't have to go through. E. coli is not asked in NEET PG, but go through the at least subtypes of E. coli, because this year we can't say it can also be asked, but it was really surprising for me to note that in ionicity this has been asked so many times. E. coli was the number 1 bacteria, but here not even a single time. So don't study immunology. I have told only 2 topics from immunology. One is antibody antigen reaction, and the second is related to transplant. Okay. Then image bank. Image bank is very much important for microbiology, because as we saw, microbiology carries lot of image based questions, and these questions are integrated type of questions also. So life cycle, cell wall of bacteria, fungi, and this culture media, they are mainly image based questions. Micro should be covered in 4 days, and in last 1 week you have to study important organisms only. That is a super revision part. That is when you give last 1 week to revise everything, mainly memory based question, either from your BTR or DVT or your 20th notebook. That time you have to go through this important organisms also. So many of you actually had emailed me regarding where is the image bank. I am talking so much about image bank in Marrow. So where is the image bank? So image bank is not available in Marrow app, but if you log into Marrow website on Google Chrome, then you will get this option. Okay, in this menu section you will see that there is an image bank option, and when you open this image bank you will get questions like this. These are MCQ questions, and you will get image based questions. Okay, so these are to be utilized for anatomy, microbiology, and radiology. These 3 are very important subjects for image based questions. So the next important question that I always get asked is, I have kept medicine for the less important or low weighted subject. The reason for that is there is so much to study in medicine, and when you study so much, you are obviously going to lose time, and in that time you can actually study high yielding topics from other subjects. So the next question is how to finish medicine within 4 or 5 days. So instead of the question how to study medicine, the best question is what to study in medicine, because not everything is important from NEET PG point of view. So now I will be discussing about medicine. So we'll see what has been the pattern of medicine over the last 6 years. So over the last 6 years, according to that data, the highest number of questions have been asked from CVS. So CVS is the most important system in medicine, keep that in mind. Second important is general medicine, where very two important questions are being asked. One is electrolyte imbalance and second one is ABG. So every exam we have one or the other question in ABG, so don't miss ABG, study everything about ABG because you are going to lose 4 marks if you don't study ABG. Then RS respiratory system, some 15 questions have been asked. CNS also around 19 questions have been asked, and most of these 19 questions are on a single topic, that is stroke. Then endocrinology also 19 questions have been asked, and infections anyways you are going to study in micro, so you don't have to give much importance here. Again, you are going to study this in PSM also. Hemat and onco you are anyways going to study in patho, so don't study from medicine. Renals only 3 questions have been asked, and so I don't think it is much important because only few important topics which I will say you go through that. So when we compare medicine, if you study general part, that very few topics are only there in general part, along with CVS, along with RS, along with endocrine and reproductive system, we are going to cover almost 70% of the total medicine topics. Got it? So now don't go to GIT and start with GIT, or don't go to Hemat and start with Hemat, or go to renals. So this is the blunder that most of us do, because there is so much information and you don't know what to start with. Okay, so go in this approach. So if you compare old and new NEET pattern, medicine is one subject where in new NEET pattern number of questions have been actually more. So this graphical representation has been purely based on numbers, but this is not actually accurate because in new NEET pattern we have less, we feel that number of questions is less. That is because in new NEET pattern the question paper is out of 200 and earlier it was out of 300. So if we take an approximate, so we will see that these red bars are almost they are as tall as the blue bars, which is old NEET pattern. So that means in new NEET pattern number of questions in medicine have increased. Okay, so how do you revise medicine? First go to CVS, general medicine, endocrine, CNS, respiratory system, and all these 5 topics. Okay, these 5 topics should be from revision videos of whatever coaching app you are following. The reason for this is because in medicine what I noticed that most of the previous year questions are not repeat questions. They are like very different questions, and these can be only you can only answer these if you know concepts. If you don't know concept, then it is very difficult to answer. So for those concepts to get it to study those concepts, you have to go to the revision videos. The best source is the main videos, but you don't have time now, so the other alternate source is revision videos, so that you cover whatever can be asked in the exam and you don't actually leave question just by studying PYQs. So one more question that that many people ask me is how to finish medicine in such a short span, because even revision videos will take 4 or 5 days. So I have got an alternate answer for that, that is go through rapid revision videos on YouTube, which is available for free by Dr. Deepak Marwa. These are around 6 or 7 videos which will take hardly 6 or 7 hours. Each video is approximately 1 hour and it will cover almost every important question that is asked. So you will be knowing concept, you will be able to answer that along with these revision videos for these specific subjects. Okay, specific topics only, that I'll tell you in the next slide which are the specific topics. Only those topics you will be reading from revision videos. Rest of the things you will be reading from this Deepak Marwa YouTube course for rapid revision, or if you have joined any other rapid revision course of medicine which can actually with which you will be able to finish medicine within 1 or 2 days, that is the best source. Okay, then PYQs are important percentages you have to bookmark then and there. So main videos are a big no, QBank is a big no in medicine, and YouTube is also big no, except for this YouTube part that is by Dr. Deepak Marwa. Don't watch anything else. Then recent updates is a very important topic for medicine. So in Marrow or any other app also you will find a separate section on recent updates, so don't forget to go through that. 5 days you have to give for medicine, out of which 3 days you will complete in theory part, 1 day in MCQ discussion part and PYQs, and 1 more day you can give subject tests or something. Okay, and in medicine it is very important, get out of this FOMO, because if you have this FOMO and then you start studying everything, you're not going to crack NEET PG, you're going to fail. Okay, then how will you perform a detailed plan for medicine? That is, see, for CVS read everything from revision videos plus ECG. ECG is very important for even for NEET PG. So ECG plus rest of the things from CVS you have to do from revision videos. For general medicine part, that is ABG, dyselectrolytemia, heat and obesity part, because these questions are recently being asked. So for these you will be watching your revision videos only for selected topics only. For endocrine you will be watching everything from revision videos, because endocrine is again it is wide varied, because questions are being asked from thyroid also, from pituitary also, and even from diabetes also. So you should have a very thorough base in endocrine. Only CVS and endocrine and this area, these are the only 3 topics that you have to study from revision videos. Okay, general medicine, as I said, only only these topics study from revision videos. CNS stroke part, if it is possible, go to main videos and watch it, because stroke is very important, especially stroke localization. If you're not able to do it, then at least go through revision videos. Then infections, you have already covered it in micro, so you don't have to do anything for this. Hemat also you have covered in patho, so don't do anything regarding this. Only go to the rheumat part, and I'll say you that will already be covered in these YouTube videos by Dr. Marwa. And in respiratory system, you have to study everything from revision videos. So if you go to YouTube, you will find this channel. See, I'm not funded by anyone, but I watched these videos and I found that this will actually help the students. There are many students who email me who actually have genuine reasons for that they couldn't complete so much syllabus in the given amount of time. So for those students, this will be useful, where you will be able to revise medicine in a short duration of time. Okay. So next, coming to the third subject, is anatomy. So anatomy against INI-CT, where in INI-CT anatomy is one of the top 6 performing subject, but in NEET PG anatomy number of questions have been coming down in the last 2 years. Okay, so you can see that in anatomy against INI-CT, okay, because in INI-CT CNS was the most important part. I already studied many times that if you don't study CNS in anatomy, you are going to fail for INI-CT. Okay, but in NEET the story is entirely different, because in NEET highest number of questions are asked from general part of anatomy, general anatomy, histology and embryology. That the same questions are getting repeated again and again. Okay, then second highest important is the CNS part, and third you will find upper limb part, followed by lower limb, abdomen and so on. Okay, so highest number of questions have been asked from general. So if you study general along with CNS along with upper limb, it will form almost 65% of the total subject that you are studying in anatomy. Got it? And I'll say you respective points from each other topics also which you have to study. So as you can see in old NEET and new NEET, so like thorax and perineum and all questions have not been asked in last 3 years. Okay, and even from upper limb also only 1 or 2 questions have been asked, but in general anatomy, in CNS these questions are, and in lower limb, to my surprise, more number of questions have been asked, and this is only from a single topic. I'll tell you which. So general anatomy is the kingmaker in anatomy, followed by CNS, then upper limb, lower limb. Image bank is very, very, very important. Okay, third, few important topics in anatomy carry maximum weightage. So it is like 20% of the topics in anatomy carry 80% of the weightage. It is just like that. I'll tell you how. And for anatomy, what you have to, if you suppose you have not followed your coaching apps, or you don't have a notes of your own which you can revise in the last 3-4 days, so that means you have to go through this. Dr. Ashwini Kumar, who is a faculty of Bhatia, he has released some videos on YouTube last year. Okay, since anatomy is not going to change, it will not matter much. So this NEET PG revision series, it's a set of some 15 videos which are around 30 minutes, so which you can complete within 1 day, and these contain the most important topics only. So okay, so this Ashwini Kumar videos, and anatomy you have 3 days to watch. Okay, 3 days to prepare for anatomy. So what are the important things to be studied in anatomy? See, in embryology, when I was going to the NEET PG previous year questions, I was very much shocked to find that only 3 topics carry the highest weightage. That is, one pharyngeal arch, where every year 1 question is asked, and in CVS fetal circulation and cardiovascular development, where every year 1 question is asked, and few questions have been asked on omphalocele and meiosis, mitosis. And in general anatomy, from 2018 to 2020, repeatedly every year 1 question was repeatedly asked, that was joints. Okay, type of joints. Next, in histology, repeatedly every year 1 question was asked, that is cartilage, type of cartilage, how you differentiate between different types of cartilage. In CNS, ideally you should study everything, but if you don't have time, then you can go through cranial nerves, which are very important, followed by cerebellum and cerebellar nuclei, Brodmann areas in CNS, stroke and blood supply of the brain. So the question that are asked recently is that they'll give you a patient who has come with some symptoms, and then they will ask you which part of the brain is affected. So stroke, what you study in CNS in medicine, is closely related to neuroanatomy. So you should correlate these 2 topics closely. In abdomen, only 2 questions have been asked, stomach anatomy and liver anatomy. In lower limb, only 1 question that is repeatedly asked, nerve injuries of the lower limb. So nerve injuries of the lower limb, don't forget, because last 2 years 3-4 questions have been asked from that part. And in upper limb, nerve injuries, spaces of the hand and muscles of the hand has been asked. So if you study this much in anatomy, it is more than enough. You can get you 3 or 4 days for revising anatomy. Okay, so next, coming to PSM. So PSM, I had divided topics according to epidemiology and health, okay, and then biostatistics, communicable and non-communicable diseases, ESI, that is Factory Act, then health programs all come under one heading, biomedical waste management and environment, like air pollution, water pollution, food adulteration, all those topics. Vaccination I had to make separate because vaccination is that important, and God knows what topic, these topics are like, even if you study everything also, you are not going to answer this. They are like random shit type of topics. Okay, so under epidemiology, under this, the highest number of questions have been asked from communicable and non-communicable diseases. That's why when you're studying your microbiology, include questions from PSM also, and I will say you which extra things to study from microbiology when you're studying for PSM. And next highest is asked from epidemiology and biostats. See, if you see this graph, okay, you will see that epidemiology plus health, biostats, okay, and these health programs and vaccination, okay, these four small topics are going to cover almost 70% of the total topic. Communicable disease, anyways, you are going to cover it in microbiology, and there are only few things that you need to focus on, and rest of the things will be easy. Only you will be able to rule out 2 options. Okay, so with this approach you can actually finish PSM in a short amount of time. So if you see last year's the trend from old NEET and new NEET, then you will be shocked to see that the number of questions in PSM in biostatistics is coming down as against INI-CET, where PSM questions were going high. Okay, but communicable and non-communicable diseases and health programs and vaccination, more number of questions are being asked. So what is the strategy for PSM? Start with vaccination, because vaccination is the only single topic that is going to matter in PSM. Every year 1 or 2 questions, sometimes even 3 questions have been asked from vaccination, followed by epidemiology plus health, then biostatistics, then health programs, and then random topics which if you don't have time, you can actually leave. So what is the source for all the above topics which are mentioned here? These topics should be covered from revision videos, and if possible vaccination, cover it from main videos. Okay, vaccination is only one topic which you cover from main videos, because you are not supposed to lose any marks in vaccination topic. So you can cover from revision videos, PYQs, Pearls, QBank. You can do biostatistics plus epidemiology, because these questions keep on repeating and these are easy questions. If you get to know the knack to do this question, then it's easy. Okay, MCQ discussion also you can watch for this biostats and epidemiology, and then recent updates are again important for PSM. So QBank, you can go through epidemiology and biostats. Recent updates are important. And what is the strategy in PSM? Strategy in PSM should be grab marks in topics which are sure, and make sure that you learn those topics which are easy to learn. Okay, like biostatistics, there are many topics which are easy to learn if you actually learn them. Okay, and rest of the topics you can actually guess and get marks. You will be easily able to rule out the option. PSM is common sense subject. Maximum time you can allot is 4 days. Okay, so in PSM, what to study? In epidemiology topic, go through relative risk, attributable risk, and population attributable risk, along with epidemiological study and study designs. This carries most of the weightage. Most of the topics from PSM are asked from only these topics. Then communicable diseases, study these 4 diseases. Varicella, okay, so you have to go back to microbiology and study these from microbiology also. Varicella, Japanese encephalitis, TB, and Kala-Azar. Okay, and in health program also you will find that NTP program, that is for TB, that will also cover this part. Okay, and ESI and Factory Act and health programs. In health program, these 2 topics are asked repeatedly. And in biostats, standard deviation, mean, mode, then chi-square test, ANOVA test, these are asked. In environment, for some strange reason, food adulteration was asked some 3 times. Okay, so don't forget this food adulteration topic. And biomedical waste management. See, these are small topics. Most of them say I conduct this membership based on-call strategy program now. Okay, so you can actually talk to me on call if you purchase my membership. So during that time, what I found was most of the people have information. They have studied for 1 or 2 years, but are not able to perform good in JT. That is because they don't know what to study. See, things like food adulteration, which no one actually studies, no one gives importance to, has been asked 3 or 4 times. This is where actually you lack in your preparation. And even like topics like vaccination, where TT prophylaxis has been asked almost every year since past 3-4 years. So these are the topics that you are not supposed to miss. Okay, if you miss this topic, then definitely your rank will come down. So this is about PSM. Next, coming to physiology. Physiology is one topic where it is very difficult to predict questions, because every time new questions are asked. Okay, so it is repeated questions are very less. So you can see that in physiology, again, general physiology like INI-CET carries most advantage. Then comes CNS, then comes RS. These 3 topics are the most important, and topics like renals, only since last 3 years no questions have been asked. So in physiology, you can actually learn only general physiology, CNS part, CVS part, and the RS part, which will give you around 75% of the total topic weightage. And in old NEET versus new NEET, you can see that in GIT no question has been asked, Hemat, renals no question has been asked, Endo only 1 or 2 question has been asked, RS also number of questions have been come down. Only from general physiology, CNS and CVS, we have questions from the last 3 years. So what should be the strategy for physiology? Strategy for physiology is very simple. Repeat questions are very less, so revision videos are a must. And that to physiology, that it doesn't take much time. Revision videos totally combined will take you hardly 7 or 8 hours. Okay, so you can finish it within one day anyhow. So revision videos are much, because it is very difficult to predict which questions will be asked next time. So go in this order: general physiology followed by CNS, RS, CVS, and then if you get time, Endo. Q bank should be done for problem based questions, especially from general physiology. So revision videos, whatever I have discussed here. Okay, Q bank for this problem based questions. You can allot up to 3 days, and number of questions in physiology is also decreasing. That's why I have kept physiology for last. So what to study in physiology? See, these are some important questions that I could compile. Okay, where one very important question was pulmonary function test, which was asked 3 times. Respiratory distress syndrome, based on those molecules and the mechanisms, so that was asked twice. And in cardiovascular system, repeated questions have been asked on blood products, cardiac reflexes, okay, and JVP pulse. These questions have also been asked. So going on to next subject combination, that is ophthalmology plus ENT. I have combined them together. So as you can see in ENT, as we discussed in INI-CET, for INI-CET, ear and nose was very important topic. Throat was not asked at all. But see the change in NEET PG pattern. In NEET PG, throat is asked the most, throat and oral cavity. That to one topic, tonsillitis. Tonsillitis has been asked many times along with larynx. Okay. So this is a shift. That's why when people ask me, do you have to study INI-CET questions also for NEET PG? I strictly say no, because INI-CET and NEET PG have their own separate fan base of questions. Okay, examiners who conduct INI-CET are different from NEET PG also, or maybe they are same, but the number of the type of question they are asked are totally different. Okay, so ear also, nose also. So everything is equally important in NEET PG for ENT. And in Ophthal, I have divided topics: refraction from refraction like from cornea, those astigmatism, myopia, all those topics till lens, okay, till cataract. Everything I have included in this refraction topic. Then neuro-opthal, glaucoma plus retina I have done separate because it is very important topic. Then squint, lid and orbit, okay, this is separate. And this community opthal and systemic opthal I have done a separate category. So in ophthalmology we will see that this refraction has highest number of questions. Again, this is against INI-CET, because in INI-CET opthal, only in the last 2 years 2 questions have been asked from this astigmatism and myopia hypermetropia. But in NEET PG, repeatedly astigmatism is a very important question, which is not at all asked in INI-CET. So again, then comes glaucoma plus retina. See, glaucoma plus retina, which is only 2 topics, 2 short topics, against this squint plus lid plus orbit, which is a very difficult topic to learn. So there only 8 questions have been asked, but here 15 questions have been asked. So this is where you should focus on more energy. You should focus on glaucoma and retina. Okay. So if you see the trend, ENT equal number of questions have been asked, and in previous year almost the number of questions are the same. So nothing has changed in ENT. But in Ophthal, refraction along with neuro-opthal and glaucoma plus retina will cover almost everything. Okay. So in Ophthal you can see number of questions from squint and lid has come down. Orbit, initially much more number of questions were being asked from orbit trauma. Okay. But from last 3 years, number of these questions have come down. Community and systemic ophthalmology, number of questions have increased. Glaucoma and retina, it is almost the same, and even in refraction it is almost the same. So what should be your strategy for ENT plus Ophthal? See, both you have to go through revision videos, and revision videos are not much, so you can finish it. Okay. Anatomy part, you can, if you have doubt in the anatomy part, especially for ENT, because in ENT one important question is 7th cranial nerve palsy, which you can't answer if you don't know the anatomy of 7th cranial nerve. So to understand that, you need a 3D representation. You can't just go through main revision videos and get to know it. So you can selectively watch those from main videos. PYQs are a must, pearls are a must. Q bank also, again, if you feel some topic is very important and you are not able to recall it thoroughly, or you feel that your preparation is not enough, then you go to the Q bank. MCQ discussion for both, no recent updates or YouTube reference needed. See, in ear, 7th cranial nerve palsy, otitis media and mastoid are some of the very important topics that have been repeated. In nose, one very important topic that has been repeated is X-ray views. Paranasal views are very important questions. Okay. Throat, larynx carcinoma, recurrent laryngeal nerve palsy and tonsillitis has been asked. So this was against INI-CET, where in INI-CET throat hardly any question was asked. In Ophthal, squint and lid questions have not been asked since last 2 years, so you can actually leave that part and just focus on orbit. Astigmatism is very important part, so don't forget astigmatism. Orbit trauma is also important, and cataract surgery is important. Glaucoma and retina, if possible, go through main videos and read full. Okay, go through main videos and read full. Also neuro-opthal also, if possible, read full, because you can expect questions from that part also. Rest, conjunctivitis, keratitis, you can actually go through your revision videos only. For MCQ discussion mainly is based on refraction and neuro-ophthalm, because there are some problem-based approaches there which you can't understand just by going through revision videos. So you can watch the MCQ discussion series only for that, and you can allot up to 5 days for both ENT plus ophthalm combined. So coming to the last part, that is radio and anesthesia. So these are the two subjects that you can actually leave. So when my friend Viraj asked me which are the two subjects he can leave, that is anesthesia and radio, because in the last 2 years only 4 or 5 questions have been asked from these two subjects combined. And radio also you can answer if you have studied surgery, medicine and OBG, you can answer almost radio. But anesthesia also very few questions are only asked, repeated questions. I'll tell you which one. In anesthesia, drugs, that is anesthetic agents and muscle relaxants, are never to be left. Okay, this endotracheal intubation in the old NEET pattern, that is before 3 years, many questions used to be asked, but nowadays no questions have been asked from endotracheal intubation. Mallampati score has been asked. CPR is very important topic for anesthesia. If you ask me everything, what is the most important topic? Most important topic is CPR. Then comes anesthetic agents and then muscle relaxants. Capnography has also been asked, so go through that pearl on capnography. Then in radiology, you have to mainly go through image bank. Again, I'll say in Marrow, go to the Marrow website, their image bank is there. Else in other apps, you can find image bank in the respective apps only. In radiology, important questions are barium study, contrast media, because these two topics are not covered anywhere else. Maybe in medicine or surgery it is not covered. So you should go to core radio. This is core radio topic, barium study and contrast media. Then rest of the topics like subarachnoid hemorrhage, barianeurysm, coarctation of aorta and TB, then intersusception. So these topics are you can selectively cover it from radiology. And in musculoskeletal system, you can go through X-rays, because those are also important for ortho. So you can allot 1 day or up to 2 days maximum for radiology. So this is the strategy for next 20-25 days for those 9 subjects. So once you have finished all this, last 1 week you will be keeping reserve for this super revision. Okay, in super revision you will be reading only those important topics which are like memory based, or you will be going through BTR only, or you will be going through DVT only, or your 20th notebook only. You will be going through only those topics which are very important, which are memorization topics, and which you will tend to forget. Got my point? So for those people who feel that they are lost, okay, for those people who feel they need guidance, maybe for NEET PG 2024 or maybe for NEET PG 2025, I have started this membership, where after applying for membership you can talk to me on call basis, where I'll be discussing strategy directly with you. If you are interested in that, you can contact me at babydocrmd@gmail.com. So in the next session, we'll be discussing the new pattern, the most important asked question to me even during my on calls during strategy discussion. The most important question that I face is how to finish 40 questions in 42 minutes, that too for 3 hours. So this is something new, and I have come up with few strategies. So in the upcoming week or this week, I'll try to upload this video on how to tackle this situation. So till then, all the best.